Hey, I'm Jeanette, the OB educator for Parkside OB-GYN. The educational information in this video is intended for Parkside OB-GYN patients only. It contains general guidelines and should never replace guidance and advice of your provider. So this is a fairly common question even early in pregnancy. When should I send a message to a nurse or provider in Healow? Or call the office? Or when should I head straight to the hospital? We're going to talk about some common scenarios, but it's important to remember that if you think you're having an emergency, that you call 911. In case you didn't already know, Healow is the computer interface that connects Tribe 513 patients with their electronic health record. And with Healow, patients have secure access to their medical records across all Tribe 513 practices. Their information can be accessed via website or on an app that's on the smartphone or tablet. You can also use it to pay your bill in full. It's an easy way to update personal information, including your contact information and insurance information. You can use it to request appointments or medication refills. Patients can quickly review their lab results and also use the program to send messages for nurses and providers. So sending a message on Healow is a great way to meet non-urgent patient needs. Patients can get answers to questions about diet or exercise considerations, travel, safety considerations, and inquire about minor symptoms or ask questions about lab results. It's also great for non-urgent requests for things like FMLA paperwork, workplace accommodations, or work and school excuses. So when should you phone the office directly instead of sending a Healow message? You should call our office anytime you have a more urgent issue where you really can't wait until the next day for a response on Healow. And this can include symptoms like a fever of 100.4 degrees or higher, or if you're experiencing chills. If you have a severe or recurring headache. If you're experiencing severe or persistent vomiting or diarrhea. If you're experiencing sharp or persistent abdominal or pelvic pain. If you're having any type of visual disturbances, like blurry vision, sudden flashes, or spots. If you feel like you haven't felt the baby move enough and you're over 28 weeks. Any new nausea or vomiting that occurs after 28 weeks. If you have a sudden leakage of watery fluid. You begin noticing swelling of your face or your hands. If you notice vaginal bleeding after your first trimester is already finished. Or if you're experiencing regular painful contractions. If this is outside of office hours, you're going to be prompted to leave a message. A nurse or a provider will call you back shortly. So when should you head straight to the hospital? So remember that Parkside OB-GYN only delivers at Prisma Health Patewood Hospital. So if you have any pregnancy-related emergencies and you need to be seen right away, you'll go to the OB triage located on the 4th floor at Patewood Hospital. This way you can see our providers and they'll give you the right treatments. So you'll head to the hospital if you are in true active labor, or if you have heavy vaginal bleeding soaking through a pad in less than an hour. If what you're experiencing is happening after office hours and you really feel like you can't wait for a call back from a nurse or a provider. If your water breaks before 37 weeks, whether or not you're having contractions. Or if a nurse or provider has called you back and they advise you to head straight to the hospital. So just a couple of important reminders. Again, always call 911 if you are experiencing any life-threatening emergency. OB triage on the 4th floor at Patewood Hospital is where you need to go in order to see our Parkside OB-GYN doctors. And babies less than 35 weeks will require a NICU stay. If you deliver at Patewood, the baby would have to be transferred to the NICU at Greenville Memorial pretty quickly, and then you would be transferred as soon as possible after that. And that transfer process can be pretty stressful. So if you are less than 35 weeks and you're in true imminent labor or your water has already broken, we want you to head straight to Greenville Memorial. You'll be taken care of by the OB teaching staff there. Thank you so much for taking the time to watch this video. Remember, this is generalized information, and it's intended for patients of Parkside OB-GYN only. This guidance may not be appropriate for every patient. Always follow the direct advice of your providers.